Welcome to this edition of COVID Conversations. It's Kruszyna, CTSB TV, and I'd like to welcome back Kruszyna on the nursing staff of Baystate Medical Center. Welcome, Crystal.
Hello, thanks for having me again.
Yeah. So it's been maybe a few weeks since we talked last. Now everybody's talking about the second wave, and have you seen any changes in the amount of patients that are coming in with COVID symptoms? Or
I think our positive cases are on the decline, percentage wise, which is great. Number of cases we have in house are very, very few, especially compared to just maybe 7-8 weeks ago. We have less than 20 currently in the house, which is fantastic.
Mm-hmm.
So we're working on developing based on what we learned, what we did, what worked, what could have been better, in case there is that second wave that comes back to our area and we are part of it or affected. So there's always plans being worked on and tweaked and talked about to make sure they're the best practices for the most current recommendations. As far as that goes, we're still seeing people coming in concerned, want to be tested. We've set up that particular area in the hospital for people to come through the emergency department where they are being tested.
Okay. So I've heard, like on news and things, the reason why there's a lot more positive testing results is because of the availability of the testing to the public. What is your view on that?
Well, it could be one theory. We know that there are more testing centers. There are more people that are coming in contact with other people that they have become concerned and want to be tested. So, the number of cases, in the news, you hear about, this is our current caseload now, this is our numbers, but they don't always kind of show out of how many were tested and what the purpose was for their testing. Some people have to be tested because now the hospitals are opening back up for their elective surgeries or surgeries that were postponed because it really wasn't the right time or the safe environment to have them done. So those people all have to show a negative COVID before they can, go forward with their surgical plans. So that, we're testing people that in normal cases might not have needed to be tested, but it is the right thing to do to keep everybody safe, keep the operating room safe and functioning, the best way that we can for the patients.
Okay. It's kind of it's encouraging to hear that our numbers are so still holding and just decreasing. Do you think it's because the fact that we're really trying to be careful and safe here, or is it just?
It has to have a big effect on it. It really does. Our governor shut everything down quickly. And then he immediately came up with a phased plan so that things can go slow and can be backed up if it should become necessary to do that without such a halting, screeching stop as we had initially when it first hit. So it has to have a huge effect on it. The talk where I am and where I go is people want to be safe and do the right thing. And if wearing a mask and washing your hands a couple extra times than you normally would, or thinking about not touching your face, especially if you have to go to the grocery store or something, it's a good thing to do. They're simple. It doesn't impose on anybody's rights. And it really works. The science is fact. It works. It helps. It's not 100% you will never get COVID if you do all those things, but the percentage that it reduces is tremendous, is absolutely tremendous. And it's a very responsible, respectful thing to do.
Mm. I was talking to somebody this weekend, and I heard that some people can have it and not realize they have it and could carry it to other people. Maybe not get really extreme symptoms, but just like light symptoms and not realize that's what it is? Is that possible?
It's true. It's true. People can basically be what we call non-symptomatic, but still be carrying the viral load. And again, that's where washing your hands and wearing your masks comes into play. Without that, that person would be more likely to spread that to other people just by simply coughing, talking loud, laughing loud, right? You project that, moisture in your breath. But you have the mask on and I have the mask on. There's 2 layers of protection to reduce you from being exposed to what I might have.
Okay.
So it's, and wearing them the right way also helps.
Yeah, to cover your nose and your mouth. I see a lot of people just having it drooped on their mouth and their nose is sticking out. And
and that, takes away 1 layer of protectiveness from the mask, because we have, our mucous membranes in our eyes and our nose and our mouth are where it's going to come in. So, yeah.
Now I see. Okay, go ahead.
Currently, I think it's the Massachusetts DPH has recommended that all healthcare workers, regardless of patient's reason for being in the hospital or having to work with the patient, we now wear goggles along with our face masks for every single patient, just to reduce the risk receiving the virus or spreading the virus should we be one of those people that are non-symptomatic or have been exposed and we're unknown.
Okay.
It's just simple things, and it doesn't hurt anyone to do it.
Okay. I've seen some people, a few that are just using face shields. What do you think what are your thoughts on that? Just using face shields alone without a mask underneath it.
You should have both. You should have both. The face shields are, think of them, if you don't have a mask, it's just an eye protection. You're protecting the upper orifice. Of course, it's better than not wearing either, but it is recommended, to wear both. You should wear both. I mean, why wouldn't you, I guess?
Okay. Well, I wear glasses. Does that count as eye protection, or should I get prescription goggles? Or
I have goggle glasses that go over my glasses. So it's a little bit of both because they have a bit of like side protection, so to speak. That's what's recommended for us to wear.
Mm-hmm. Yeah. So we're seeing, like, are we on level 4 yet, or is it still level 3?
I think we're still only on 3.
Okay.
4, I think, is the rest of what's not open.
Oh, okay. So
that's what I think as I listen and try to read. I know I don't read everything.
Mm-hmm.
But
I don't either. It's like I like to go to the source of things instead of hearing. It's almost like hearsay, with the news.
And there's a lot of it out there.
Yeah.
There is a lot out there.
So some of the restaurants are opening, and some of is it bars also? I know.
No. Yeah, I think the bars cannot open yet.
Okay, all right. You see, I've seen a few people not wearing masks at the stores and things, and it kind of, not a lot, but and is it up to management to approach them and say,
I would think that they should and could and hopefully would.
I feel
they really should. It's a public place, and it's what's being asked of the public for safety, and it's what's going to help us move forward quicker. Mm-hmm. Even if you don't like it, it's you're not a proponent of it. You feel it's infringing on your rights, but just think about what it's going to do for the mass as a whole, not just you particularly. You wear a mask, and we get to move forward. You don't wear a mask, and some numbers change, and we could move backwards, and that's not fair. Right. You don't have the right to make that decision, is my opinion.
It's almost like, okay, we're starting to open things up, but that doesn't mean we still have to be careful, and we still have to be diligent. And it's like, I even find myself, when this first happened, I was going to the supermarket and taking and wiping down all my groceries as I was picking them off the shelves, and I find myself not doing that and not wiping down my nail when I get it with
Yeah.
Clorox wipes. And it's like, I think it's like we got this thing in our mind. Well, we're starting to open up a little, phase three or whatever. We don't have to be as careful as we were in the beginning, but
I know. We still need to think about it every day.
mhm,
We do right now. We just do, because it is what's going to move us forward. Our country needs to be a full running country again.
that's right.
It absolutely does.
As long as we're careful and
Mhm.
and uh, diligent and mindful of our spaces, and you know,
Mhm.
I'm
We have to learn to live with it again, so we can just get going, get back
mhm.
to whatever the normal is, so to speak. Yeah.
Is there any new treatments that are being applied at Baystate, or any kind of uh, like I hear that there's trials for vaccines. I don't know if you'd be doing it there or not, but
Not that I'm aware of, but I'm one person in a humongous organization.
mhm,
But we're watching the results and the trials very, very closely.
okay.
Yeah. And the treatments that you hear about, the treatments that have some proven evidence behind them are treatments that we're trying with the patients that we have.
Mhm,
Like the antibody. Um, we're using some of that with patients. We have a
mhm.
specific infectious disease doctor that discusses with each patient that might be appropriate for those treatments.
Okay.
That's his role in the COVID plan.
Okay. So the antibodies, are they taken from people who have recovered from the COVID?
Yes, voluntarily. Nobody.
Okay.
Yeah.
I guess so. You're starting to use some of these antibodies on some of the patients. Are they recovering any differently?
We believe that some of them, definitely their intense symptoms have lightened. Some of them, we feel that it's helped shorten their need to stay in the hospital. The
Mhm.
recovery is shorter, so they have less downtime. What they need to do to get back to who they were before becomes a little easier for them, and they don't need as much rehab, I guess you could say. So
Okay.
it definitely has played a role. We're continuing with the treatment. So
Okay. Yeah, I was hearing horror stories. Even people who have recovered have damage to their organs, their lungs, to the liver and kidneys.
yeah, it's a virus that attaches to the lung tissue, but it has affected multi-organs in different people. Absolutely.
Yeah.
Absolutely. As the body tries to fight it. And, some of our body's own mechanisms to fight against a virus or a bacteria actually hurt other parts of our bodies. So
Mhm.
it's just, what it does to just try to survive.
Wow. It's like trying to live cautiously. I get afraid because of, I'm not getting any younger, and it's like, I think I would have a hard time if I did get it, and you know, um, so you have to do as much as we can to prevent that, and so
Absolutely. But we still need to live as well. So
right, right. So you said that you're wearing goggles now, and in addition to what you were wearing before, your
with
face
every
mask.
patient. The difference is we wear it even if you're on a unit that has absolutely no COVID patients.
Okay.
You completely wear your mask and your goggles. It's recommended to help reduce any kind of transmission of the virus because people sometimes are non-symptomatic.
Now, I see there's great increases like in Florida and Texas. Um, do you, my feeling is a lot of people are going to Florida from different states and bringing, they're bringing the virus, more chances for contamination, to Florida and to Texas and the southern states. They didn't seem to have a big spike in the past few months. Now it's hitting down there because people are thinking, well, it's safe down there. We can go. And Do you think
I heard
that's the so?
Yeah,
Uh,
is it just the traveling of the virus, or the people back and forth? I don't know, but it is kind of strange that it just kind of travels. It actually seems like it travels like a
so
bad hurricane.
yeah, like maybe the wind, the air, or so. Who knows? But so we were hit pretty hard, and then initially, like in the Boston area and things. So you think that hopefully it doesn't come back.
Let's
I
hope not.
like what we're talking about. So as long as we're careful and diligent and
Yeah, just think about it. It doesn't mean you can't do things. You just have to put a little extra thought
yeah,
into it. And it is, yeah, just think about the person standing next to you. It's not
yeah,
always about yourself. I don't
yeah,
like the masks, but we wear them. It's
yeah.
not my favorite thing to put on every day, but I do wear it. So,
Yeah. Um,
mhm.
I have an 18-year-old now, and he thinks he just he's got the attitude. Well, it's just like a bad flu, Dad. And it's like, well, you don't understand. Maybe for you it might be, but for me,
Yeah.
these kids
Mhm.
go hang out, and I don't think they're as careful as they could be. And
They're probably not. It's the nature of their age. It
yeah,
just it is. It's unfortunate, but it's factual.
yeah. So that's why I'm losing all my hair. I'm worrying so much.
Well, when it's all gone, you won't have to worry about it. Just kidding.
I wish there was like a little closet room you could just disinfect them when he comes home, or something. I could use it too, but uh, yeah, it's nerve wracking. It's like I see people out there who are not careful, and even standing in line for ice cream the other night, it's like people aren't wearing, and I wear mine, and then I stand far enough away, but you
Hmm.
know, what is this? If somebody's not wearing a mask, what is a safe distance from them? Is it really 6 feet, or is it a bigger area?
At least 6 feet.
You know,
Hmm.
um, even in like a park or outdoors. You know,
I know. It's tough to think about what is the right thing to do to keep yourself safe, but we have these
yeah,
great guidelines and they're not just pulled out of the air. They're based on some evidence, research, science.
yeah.
So, following and just trying to keep up to date is the best that you can do,
Hmm.
unless you have a magic wand. But
Hmm.
yeah.
So hopefully they'll have some kind of a vaccine or something soon. But we um, I hear things, and you don't really. Everybody's hopeful or they're testing certain vaccines, and you know, um,
It's kind
and
of amazing that it's happening already.
yeah,
That vaccines are created and being tested. I
well,
think that's amazing.
hopefully it'll be some kind of a incentive to get it done, and um,
But
so
I think there is, and there's so many different companies, entities across the state, across the country, across the world that are pooling resources and knowledge and data to work together because it's worldwide important. So
yeah,
it's really kind of amazing that that's happening. It's
yeah.
awesome.
I was hearing, and getting patents. Everybody has to have patents now for their
Yeah.
vaccines and stuff. It's silly. You know, I think the reward is saving lives and not making a buck.
Hmm.
But
Yes.
it's not that way though.
Unfortunately, no.
Yeah. So the hospital is still prepared and ready for any scenario.
There are plans with different levels of plans and different phases
Hmm.
depending on what happens. And the last phase, the last wave of the first wave of the COVID was, despite everybody knew that it was most likely coming, it's still like one day it seemed like it wasn't here, and the next day it was full blown. So it happened really fast, and now we have a lot of data and information, and things that worked really well, things that could have been improved, and we've discussed how to improve them. So should we need to put those plans in action again, we should be readier than we were before, and hopefully keep people as safe as we can. So we're starting to try to pull some normalcy back into what we do at the hospital. We've just a short while ago, we allow visitors in now. We have limited visiting hours and restrictions on one person per patient at a time, but patients can now see their family and friends, which is humongous. We had to kind of take that away from them in the name of safety and the right thing to do for all the patients, and being able to give that back, open it back up is tremendous, because patients, they need those people to come see them and help support them and help make decisions. So we're working on normalcy without losing sight of the possibility of having to go through something like that again.
Now, is that the visitors just for the regular wards, or can COVID patients be visited also?
Right now, the
No.
COVID patients cannot, but everybody else can.
Okay.
Where we closed it to absolutely everyone. There was no visitors at all. If somebody wanted to bring a cell phone, they had to come to the front door.
Oh.
And that's as far as they could go, so they could at least talk to their family member. It was kind of sad, but it was, based on recommendations and safety, it was probably the right thing to do. And now, backing up a little bit and allowing them to come in and actually hold their hand again, and like I said, help talk to the doctors and make decisions on what was going on. It's huge. It's huge to be able to bring some things like that back to our patients.
So, like patients from the start of the outbreak, so you're learning more about treatments, and so the recovery might be sooner than they were back then. Is there any patients who are still there from the beginning, or?
I don't know that. But we've had some lengthy stay. We had a patient discharged after 90 days.
Yeah.
He was with us, from the very beginning. 90 days. And so most of us that had worked on the COVID units had met him or talked to his family on the iPads and rooted for him. So it was a super tremendous day when we could discharge, that patient. And we've had other patients that have been there for 60 days and anywhere in between. So we've had some patients from the beginning that have just recently gone home. So it's, So hopefully with what we've learned and what we are still learning, we'll find a way to have this not be so deadly for those patients.
Seeing in Florida that they're running out of ICU rooms and ventilators and things. Now, is that because they weren't prepared, or they just didn't realize the severity of the outbreak down there?
Or it could just be it grew so fast. It just became like an overnight overwhelming need rather than one or two. You can't predict how many are going to come through your door on any given day and require that kind of care.
Yeah.
It could easily just be that it grew so fast. So fast and furiously. It sounds a lot similar to what we recently heard New York saying, we're running out, we need this, we need that. But it just grew so fast.
Yeah.
Some things will double in size. It might have tripled or quadrupled in a day, the need for that. So
hopefully you've been building all these ventilators back a couple months ago. Maybe they can mobilize and bring them to where they're needed now. And
seems logical to you and me.
I know, it's like
it's logical to us.
Easier said than done, I guess. You have to go through all the bureaucracy, and But
You think there would be no red tape for these kind of things, but there probably is.
yeah, looking to the future, we're
Me too.
still trying to see if there'll be school this
I,
fall.
I hope the kids go back to school. I know that a lot of teachers are concerned and worried about their health, and but we have to learn to create some normalcy in our life, and so that a lot of fear and anxiety takes over for people, and
It's not good.
it's not healthy. You can't live that way on the edge all the time.
And I think we can thrive and survive by being being creative, and it seems like the businesses who are doing well are the ones who are adapting to the situation, and we have to be proactive and adapt. And the school systems, the schools should do the same thing. They need to adapt, and the kids do need it's not good for them to be home on computer learning all the time. And
I don't think it's a good 24-hour a day planning. I don't make those rules. I mean, they need to see each other. They need to understand, humanality, and how to interact with each other. And life is different on a computer. It's not the same. It's not the same.
We're seeing a change in interacting professionally in our work now. We do meetings like this, and it's probably we're going to probably see them a lot of people using it in the future too, and it's bad in a way, because we don't have that those person-to-person interaction. We just have a screen interaction, and but
it makes things sometimes very cut and dry, black and white. There's no middle. There's no feeling or compassion to what you do sometimes on a computer. It's just
right. Again, I thank you, Crystal, for giving us some updates and some, we need some good advice and common sense. That's
I think most people want to do the right thing. I think so. I think it has to be part of why our area is doing so well, as far as keeping the sick down and the spread down, decreasing. So we have to be playing a huge part in that. It cannot just be that we're sheltered from the rest of the world.
I see a lot of people visiting from out of state, and that it's nerve-wracking, but just gotta live with it, I guess.
A lot of people are spending a lot more time in their summer homes in the area than they used to.
Well, Crystal, thank you for joining us again, and Mitch Kruszyna from CTSB TV. Have a good day.